stay a while and listen.
Skin aging underlined by loss of capillary macrophages. These immune cells have a specific function. November 4, 2025. Share. Capillary macrophages maintain the integrity and function of the smallest blood vessels. With aging, these macrophages become depleted, which restricts blood flow. Stimulating their growth may be a method of future treatments. A new study ties the disappearance of capillary-associated macrophages to age-related vascular degeneration in the skin. Boosting their function with a growth factor offers a possible avenue for anti-aging interventions. 1. Macrophages, capillaries, and skin aging. Skin aging might not be the most dangerous aspect of aging, but it certainly is one of the most conspicuous. It also provides a valuable model for studying aging as a whole. Skin thinning and pesky wrinkles have multiple origins, including diminished blood supply from the capillaries that permeate the skin, too. In this study published in Nature, researchers from New York University School of Medicine investigated the role of capillary-associated macrophages, CAMs, immune cells that reside near the capillaries, where they clean debris, fight pathogens, and facilitate tissue repair. Aging tissues lose resident macrophages, 3, and microvascular function, but how these are linked in living organisms is not clear. This study aimed to determine if CAMs in skin decline with age, if such a loss impairs capillary perfusion and repair, and if they can be restored. In vivo imaging reveals waning function. The researchers used an ingenious technique for in vivo imaging, which allowed them to analyze blood flow and skin condition of live mice longitudinally, from 1 to 18 months of age. Older tissues show fewer blood vessels, said Kylan R. Mesa, currently assistant professor at Princeton and the study's corresponding author. To understand how these changes develop and lead to age-related dysfunction, we built a multiphoton light microscopy imaging system to track tissue aging in living mice. Time-lapse imaging showed that upperdermal CAMs declined faster than epidermal or lowerdermal macrophages and faster than capillary rarefaction itself. Thus, macrophage-deficient vascular niches are created, with capillaries devoid of CAMs. These capillaries without nearby CAMs experience higher rates of obstructed red blood cell (RBC) flow. Human skin samples analyzed by the researchers showed the same pattern. CAM decline outpaced capillary loss, implying diminished coverage with age. Acute macrophage depletion reduced blood flow even more. According to this paper, aging leads CAMs to significantly skew towards loss rather than proliferation, contributing to their decline. Injury and a growth factor boost macrophage recruitment. The study also revealed that CAMs are required for capillary repair and preservation. Following precise laser clotting of single capillaries, nearby CAMs were rapidly recruited within about 2 days and engulfed RBC debris. Capillaries with local CAMs were significantly better at re-establishing blood flow after injury than CAM-devoid ones. Ablation of CAMs prior to clot induction impaired capillary repair, indicating their critical role in vascular recovery. The researchers then applied larger laser wounds to the upper dermis or the overlying epidermis to test whether more serious tissue damage triggers CAM replenishment, which it did. We found that large laser-induced epidermal damage resulted in a lasting increase in CAMs below the damaged regions compared within the neighboring control regions, the paper says. Basically, while CAMs hardly renew on their own in aging skin, the study suggests that environmental changes, such as injury, can stimulate CAM replenishment and enhance vascular function in older mice. Colony stimulating factor 1, CSF1, is a growth cue that tells macrophages to survive and divide. The team used CSF1-Fc, an enhanced version that makes the signal hang around longer in tissue to test whether it can improve CAM function by microinjecting it into the skin of old mice, 20 to 24 months, once a day for 4 days. This treatment resulted in more capillary-associated macrophages, CAMs, lining the tiny vessels without noticeably changing the balance between long-lived resident cells and freshly recruited ones, which are derived from monocytes.